didn't make any sense. So there's a big article online that I wrote. Now, whether the injury was done before or not, we're not going to have all the answers. And I think there's more questions that is to be answered here, and nobody has the final answer. But what we have is one of the most well-known and really a legendary forensic pathologist. Dr. Wecht is online with us, and I want to get his opinion. And in the studio, we have one of the most famous spine surgeons, Dr. McCance, who was also a friend of mine from Mount Sinai, and now he does a lot of work at Lenox Hill Hospital, and he's a co-director of Spine Institute, and he's well-known, and I trust his judgment. So, Dr. Wecht, good morning. Welcome to the show.
Yes, good morning, sir. Pleasure to be with you.
I have a lot of, as I read all the studies and reports that came as a result of this, they were talking about the fact that he may have been on marijuana and also like heroin, and we don't know how much heroin is in the system or not. And also, he was asking for some sort of an inhaler. So, as a medical doctor, as a surgeon, the question that comes to mind is, does he have any kind of respiratory problem that he was grasping for air? Was heroin inhibiting his respiratory effort, plus that he was excited and etc., and any kind of pressure on his neck? So what do you look for as a forensic? So I'll give you a scenario. So you're saying that he was lie down in the back, and somebody with a knee pressed on his, let's say, lumbar.
I doubt that it's the lumbar.
Thoracic.
My understanding, I don't really know, sir, but I kind of thought that it's the cervical vertebrae because they keep talking about the neck, so I don't know. And of course, as you and your distinguished colleague there are fully aware, you know, with the C4-5, if you want to stay alive, you've got that innervation coming down there into the heart and lungs, and if that cord is damaged at that point, then, you know, you're not going to be able to breathe.
That's right. So I said C1, C2 yesterday on Fox News. But let me go to, please stay with us. I'm going to go to Dr. McCance. So let's, and you're one of the best spine surgeons, and you should hopefully help us like solve this. If there was some sort of like a thoracic injury, let's say they put their knees on his back and they broke, and which is very hard to imagine that you can break someone's back, but let's say it happened. It would be most of the functions below that level, so he wouldn't be able to walk, or he would have some bowel issues or urinary issues, etc. Right? He's not going to die from that.
That's right, David. If you put a lot of force on the thoracic, and the thoracic's probably a little bit harder to break because of the rib cage, which stabilizes that part of the spine. But if you put a lot of force on that, you'd probably break the spinous process, perhaps something more. If you were to contuse the cord, which would be hard at that level, you would have something from the chest down, not affecting the arms, not affecting the breathing.
So could there be, like, so you think also that if that's what my research brought me to this, that maybe it's some sort of a C1, C2 from real hyperflexion or hyperextension, I apologize, that could have done this. Is that a possibility?